Very good afternoon. See, we started with nosodes. Okay. So we'll have a quick recall of what was done, and then we'll continue with today's class. So, what is that quick recall we are planning is we will. We'll quickly try to understand what we had discussed, and then we will start with today's topic. So, what was it that we had discussed about nosodes in the previous class? Okay, I mean, initially we spoke of what a nosode is, and we introduced nosodes, meaning when to prescribe nosodes, when not to prescribe nosodes, all those things we discussed. And once we did that, in the second part, we started taking up individual nosodes. Okay. So to name few that we have already completed, we have finished with Pyrrhoxinum and Soranum is done, Bacillinum is done. Must be Medernum is something we have just started. Okay, anyway, I will not start with Medernum today, or I will not continue with Medernum. I will be starting a new remedy. So today we will look at a fresh nosode, and we will try to understand next 30-40 minutes what this nosode is, okay, who introduced, and the clinical utility of this particular nosode is what we are trying to understand in detail. Okay. Now before I introduce this nosode, see, if you look at the classification, we spoke of nosodes coming from plants, nosodes from animals, and nosodes which are prepared from the disease part of a human being also. Okay. See, if we again broadly look at the nosode classification, there are plenty of nosodes which come from this particular background, and those remedies we call them as tuberculinums, meaning which are prepared either from the diseased lung or the diseased sputum or the bacteria itself. Okay. So as a PG scholar, what are those remedies that you can recall from your, understanding and from your learning? What are the common nosodes which belongs to tuberculinums? Very good. Bacillinum? Lysinum. So lysinum is what? No problem. Lysinum is saliva, rabid dog. Okay. No issues. We are not looking at that, and it's a little confusing. I will come to it. But no, the question is very simple. Common remedies, common nosodes which come under this particular heading. I will reveal. So we have something called as Tuberculinum avis. Okay, fine. Birds. So Tuberculinum avis is prepared from Mycobacterium tuberculosis aviar. Okay. So this is one remedy that is prepared, and then we also have Tuberculinum bovinum. Okay. Any idea what this is? From cattle. Okay. So prepared from the pus of tuberculous abscess. So when you have a remedy which is prepared from the tubercular abscess, pus, okay, so that we call it as Tuberculinum bovinum. And then we have another variety, and this is Tuberculinum cox. Okay, so this is what we commonly use, Tuberculinum cox. Culture of Mycobacterium tuberculosis. Okay, what is that common tuberculinum we use now? This is this particular remedy. And moving ahead, we also have Tuberculinum marmorec. Any vague idea what this is? Okay. So, obtained from horse vaccinated by the infiltrates of young cultures of tuberculosis bacilli. Okay. So this is one, and then you have what we commonly use, Bacillinum burnet. Now what is this prepared from? See, Dr. Boring used a different source. If you read Dr. Burnett, he is the original person who has contributed this. But anyway, see, there is a controversy if this is prepared from the maceration of the tubercular lung or it is prepared from the tubercular sputum. A person suffering with tuberculosis, from his sputum it is prepared. But majority of the books, they say prepared from sputum of tuberculosis patient containing the bacteria. Okay, containing the bacteria. So this is Bacillinum, and then we have another thing, last thing, Bacillinum testium. Okay, so this is a remedy which is prepared from testicles of a patient who is suffering with tuberculosis. Okay, fine. So these are all the common nosodes which belong to a common group called as Tuberculinums. Not Tuberculinum, you have apostrophe S. They all belong here. Okay. Hope this part is clear. Fortunately, we have only 2 remedies in your syllabus. Okay. Out of the 6 I have mentioned, only 2 remedies is what we are going to discuss in detail. One is Tuberculinum cox and the other very important thing is Bacillinum burnet. Okay. These are the only 2 remedies mentioned. So the other things you should know, because recently I was correcting Kerala students in a PG questions online valuation. I was validating. So there I saw this question, mention the common nosodes prepared from tuberculinums. Then there was a sub question, describe one remedy, some remedy in detail. So assuming you get a remedy, I don't want you to miss. So with that intention, I am just giving you the other tuberculinums we use in homeopathic materia medica. And as I just mentioned, Bacillinum and Tuberculinum is what we are going to discuss in detail. Okay. So now the million dollar question is, will I be doing Bacillinum or will I be doing Tuberculinum? Anyway, I made it very simple. Out of 6, it is only 2 now. Now the question is it Bacillinum or is it Tuberculinum? So this image will make things very easy for you. So if I am talking about Tuberculinum or Bacillinum, this image will make things very clear. Now what is this image? Why will this image make things very clear for you? Yeah. So how will this image make things easier for you? So this gentleman is none other than Dr. Burnett. And here I have shown you something. Only place where Dr. Burnett's name is mentioned is here. Okay, so Dr. Burnett, and what do you remember about Dr. Burnett? I mean, I know you would have studied in your first year BHMS how stalwarts got converted into homeopathy. Okay, so if you look into the history, Dr. Herring and Dr. Burnett, they both were allopers. Okay, and they were sent to understand what homeopathy is, or they were told to write against homeopathy, because homeopathy during that era it was booming. Okay, and they were sent from the other school to write against homeopathy. Okay, but before writing against homeopathy, he wanted to understand what homeopathy is. Fine. And when he started understanding homeopathy and when he started experimenting or seeing the results, he himself convinced that it's a beautiful science. Instead of writing against homeopathy, his contribution towards homeopathic literature is amazing. There are a lot of books that Dr. Burnett has written, especially on rare remedies, small remedies, which are very handy for practitioners. So not only literature, he has also proved a lot of homeopathic remedies. Okay. So one such remedy that we are going to discuss today is a remedy which is prepared from the sputum of tuberculosis patient and the condition is the sputum should contain the bacteria. What is that bacteria? Mycobacterium tuberculum. So this bacteria should be present in the sputum. Okay. And the remedy you all know is Bacillinum. Is Bacillinum. Okay. Accidentally invented. So a nosode of tuberculosis named and first described by Dr. Burnett. Okay. Fine. This is okay. No problem. So I've just taken a small quote, small phrase from Dr. Borix. Okay, under introduction he says, Bacillinum has been employed successfully in the treatment of tuberculosis. Okay? Its good effects seen in the change of the sputum, which becomes more aerated and less purulent. I'll be talking about the lung affections in the next class in detail. Okay? But what I want you to understand is, how is Bacillinum helping? So you have a patient who is having tuberculosis and the sputum is very purulent, dark, greenish, etc. So if you give Bacillinum, how will you understand that Bacillinum has helped this particular patient? Symptomatically there can be a lot of improvement. But what happens to the sputum? The sputum becomes less greenish, less yellowish, it becomes more whitish, and the odor, also starts reducing. So indirectly, what is it giving you an idea, a clue that the infection is coming down. Okay, this is what Dr. Borix's observation is after giving Bacillinum. Okay, so we'll move further and quickly we'll look at the sphere of action. Okay, so where do you see Bacillinum acting? Right? Huh? Very good, skin. I'm happy. You did not shout lungs. I'm happy you told about skin. Good. Skin. Yes, one. Second area. Which is the second area? It's a respiratory remedy. It's a respiratory remedy predominantly acting on the respiratory tract. So I would like to put lungs first and then I would like to put skin. But in between you also have one more area where you see Bacillinum acting. Now which is that area? Which is that area? So you see this remedy not only acting on the lungs, you also see this remedy acting on the glands. So I'll tell you in the next slide which gland and what is the effect. And as rightly told by Dr. Madhav, you also see this acting on the skin. So three areas, you have to remember when you are looking at the sphere of action. The sphere of action is where the remedy acts. Now what is the next important heading we are going to understand is acting on these areas. What is Bacillinum producing? What is Bacillinum capable of doing is what we are trying to understand. So acting on the skin, acting on the lungs, it causes inflammation, it can cause bad cough, it can cause breathlessness, and in the next class you will realize it can cause various pathologies. As severe as tuberculosis or even in non-tubercular lung affections, you have many areas where Bacillinum can be indicated. Okay, so inflammation is one, and the second area what you see is the lymph nodes, the glands. Which gland? Which gland also becomes very important. So predominantly it affects the lymph glands around the neck. One. Second, I would put this first, and its affinity for the mesenteric glands. Its affinity for the mesenteric glands. And the third and last is it also affects the inguinal glands. Okay? Mesenteric, inguinal and the cervical group of lymph nodes. Okay? See, by now as a PG scholar, you know many remedies affecting the lymph nodes. Okay? Done? And what each remedy is capable of doing is also something you know. Fine. Now what is Bacillinum doing here is important. It can cause inflammation, It can cause swelling or it can cause induration. It can cause induration. Okay. This is what you need to remember. Okay. Any other remedies acting on glands? Calcarea, car, Cistus canadensis, iodum, conium, Barytica, good, bromium. Bromium predominantly parotid. And what is also very important in bromium? The glands which do not suppurate. Seldom suppurates is the word given in any good book, any good material. Okay, seldom suppurates. When they separate, which are all the remedies that come to your mind? It can be hepatic, it can be calcarea salve, it can be silicea. Okay, fine. So these are few remedies. If it is only inflammation, then you can think of remedies like belladonna. Okay. So here you see mesenteric, inguinal, and the cervical group of lymph nodes getting affected. Okay. Say when 2 or 3 cases that have come, I have not used Bacillinum much in my clinic, and I'll also share 1 or 2 cases where I have used Bacillinum. But recently we had 2 or 3 cases of young small girls, not young, small girls, 6 years, 7 years with bad pain abdomen. Okay, and in both the girls I saw this pattern, and they came back to back. Within a gap of 5-6 days they came. I don't know, could be some infection, viral infection. Okay, so both of them had bad pain abdomen, vomiting. Okay, and I initially gave them some remedies. Unfortunately, it did not help. When we got this scan done, in both cases we saw the mesenteric lymph nodes enlarged. Okay, and what I found in both the cases was pain used to aggravate every time those 2 girls they were eating. Right? I say a very simple thing. Pain abdomen on attempting to eat. Every time they attempt to eat now, they get pain. This was the only PQRS I got. Okay? This was the only PQRS I got. So both the cases beautifully got helped with a single remedy. And what is that single remedy? In which this particular symptom is very prominent. Dr. Boric, in his Materia Medica, he writes this. Every attempt to eat brings on colic. And I have been insisting, being a teacher is the biggest advantage. For your sake I learn, and the beauty is I get a chance to apply it in my clinic, benefiting my patients. And I come back to you and I can also share what happened after that particular remedy was given based on a Materia Medica in which we read. Any wild guess what is this remedy? Simple remedy. Must be a simple remedy. Tinu is telling something. Sulfur? No, it's not sulfur. No issues, no problem. No, it's not MacPhos, it's not colocin. Say no, you will come up with all colic remedies. MacPhos, what is it? Iodum. Okay, colocin. No, unfortunately. These were the remedies I had given initially before scan. I failed. That's why, because kids know I did not want to take a risk chance. I said no. 2 days they are not better with my medicines. I am missing something, please get a scan done. Okay, scan shows mesenteric lymph nodes. That's okay. Fine, that's not a worry. It is showing some underlying infection. You treat the underlying thing. This is the lymph node enlargement is just the result. Okay, you treat the basic underlying problem. The lymph nodes will disappear. Okay, so the remedy is calcarea phos. Calcarea phos. So kindly go back home, read calcarea phos in Boric's Materia Medica, and under abdomen you have this symptom beautifully mentioned. Now inflammation, swollen glands, and the glands are indurated. See, moving forward, what you also see here is the skin. which Dr. Madhu was confidently telling. Now I know, being from the OPD background, you would have seen a lot of physicians, lot of teachers prescribing Bacillinum for a specific condition which is spoken very high in our literature, and the condition is tinea. Tinea versicolor. Fine. Not only tinea, it is also a remedy thought of a ringworm. Okay, fine. So for time being, it is tinea versicolor, and you also have ringworm infestations. Okay. Hope I am clear. We are talking a remedy by name Bacillinum burnet, and it is told Bacillinum burnet because Burnet was the person who introduced Bacillinum to homeopathy. Okay, a very interesting remedy, deep acting remedy, nosode, having predominant action on the skin, lungs, and of course the glands. Okay. So moving further, there's some problem with the PPT, some technical issue, but what I want you to understand is, if you just look at the image here taken from Google, I am focusing on an area. The area that we are looking at is, how do they look? What is the physical constitution of Bacillinum is what we are trying to understand. Okay. Now anyway, let's forget about the PPT. There are some issues today. But what do you think could be the probable physical appearance? I am asking you this question with the background of tuberculinums. Fine. So whatever remedies I showed you, 6 remedies, all the 6 will have typically this physical appearance. Now what is that appearance? People who are emaciated. See, there is this tubercular miasm which is under the background. Fine. So people who are tubercular, predominantly tubercular, they are lean, they are thin, they are emaciated. Fine. So this is what Professor Vithokas in his Metica Medica, he says the constitutional types that needs this remedy is usually characterized by a flat, narrow or hollow chest. I hope it's all clear. Shoulders thrown forward, an undernourished appearance, and skin color going from a deep yellow to greyish brown. Okay, this is the typical appearance. Malnourished, undernourished, lean, thin, weak, emaciated. This is how they look. Okay. Now, which are the other remedies that you can recall? Okay, Abrotinum, again an emaciated remedy. Iodum. In spite of eating like an adult, you see an iodum child being very lean and thin. Now, why do they emaciate in iodum? Why do they emaciate? I mean, again, plain iodums I have used very less in my clinic. Barrate iode, calcare iode, aurum iode, I have used to the fullest extent. Calcare iode I have used. But plain iodum in my clinic, usage is very less. I remember a very young girl, 13 years, 14 years old girl. She was brought by her mother, and both were contrast in the physical appearance. The girl was very lean, thin, and mother was very obese. Okay. So mother used to tell, when the hunger part came up in the case taking, sir, she eats like me. She eats like me, but see how she is looking. And whenever I take my daughter to the function, all my relatives keep scolding or making fun of me. Do you give any food to your daughter, or you are only eating everything? Is what they keep making fun of me. So trust me, she eats like me. But I don't know why she is not putting on weight. And if I remember, she had a bad corn in her foot. She came for corn. Okay, and this is way back. Today the same girl is married, happily married with a smart young boy. She comes for him Okay, fine. But what you have to understand is, there way back I had used iodine. Thermally she was very hot. In spite of eating like her mother, and mother says, sir, I eat like what my daughter should have eaten. I eat very less, but I am putting on weight. She is like me, but she is not gaining weight. Now why do this thing happens in iodine? Huh? Going back to your physiology, it mainly acts on the BMR, right? Basal metabolic rate. So in iodine, the BMR will be high. In spite of eating so much, because of good BMR, they don't tend to put on weight. They're very hyper, they're very active, very restless people, and they need that kind of an energy. Okay, so iodines can be lean. What was it? Tuberculinum. Any other remedies? Sanicula. It's a combination of so many things. Sanicula, yes, absolutely right. Sanicula. Alumina. Fine. Ambragracia. Okay. Sulfur. Arsenic. Sorinum. The list will go on. Ammonium, mure, natron mure. The list will go on. But I'll just give you a small clue. The rubric in your repertory will be generalities, lean people. Generalities, lean people. People are very lean. Okay. I have used this rubric with good benefit. But just make sure when to use this rubric. She was fat, after diabetes she has become lean. Don't take lean people. So she has become lean because of a pathology, because of a disease. Right? So you should be a little careful. So lean people, you have got many remedies, Naxomica, stannum, magnesium first, and the list goes on. Okay, so moving further. Okay, so again, whatever I am talking for next few minutes is taken from Professor G.V.'s book, Boric and Clark. Okay, because this information is not there in all materia medicas. Even there is one beautiful book, Nosodes by Dr. O.A. Julian. Even that can be referred. Okay. So what you have to remember here is, see, this remedy, must be. I'll just come back to this slide a little later. Okay. Yeah. So this is what should have come first. See, as per Professor G.V., Bacillinum patient presents the following characteristics in their medical history. So this is his observation from his experience. What he has seen, he has penned down, and for the benefit of the students, I have taken this from his book. So what you need to understand is, people, Bacillinum patients, they are prone to take cold very easily. So what is the word you have? Susceptible to catch cold. Okay. Now how do you interpret this in your clinic, or what do you understand by this particular statement? Small cold, right? Small exposure to cold air, they tend to catch cold. Small change in food, they drank something cold or they ate something cold, they got exposed to cold, or somebody is sneezing, her friend is sneezing, so they catch cold. So tendency, you have a rubric under generalities, tendency to catch cold. So I am giving a broader picture. So when you have a patient who has this tendency to catch cold very often, you can take that rubric. That will give you a lot of remedies. Bacillinum is one such remedy which has this tendency, to catch cold easily, not only easily, frequently, and from which they do not recover quickly. Sir, it's been 7 days, it's been 10 days, I'm sneezing, I still have coryza, I still have cough. So this is how they narrate. No matter what medicines are used, the cold drags on for a long time. I have been taking allopathy, homeopathy, Ayurveda, whatever it is, but my cold is not settling down. Okay, I am not getting better. Is the statement given by Bacillinum patient. See, many times Bacillinum is not used so often as it has to be used, because we don't know much about Bacillinum. Probably from the masters, from the source books, we have a lot of information. Okay, so when we read that, when we understand that, probably we can start applying the same in our clinic. Okay, fine. So remember this. Who are the other people who are more prone to cold? Calcareca, herbacil, Baraita is absolutely tendency to take cold. See, in Baraita, throat. Remember, good. I am happy you thought of Baraita. Baraita, cold settles in throat. So you will see them having more of tonsillitis. You will see them having more of sore throats. That's more of Baraita. Very good. Calcareous, Hepar. Hepar, it's got to do with the sensitiveness to cold. If you read Dr. Kent's Materia Medica, what it says, somewhere the window is open. Somewhere means in his house only, not somebody's house, window is open and he will get cold. Not that bad, but a small space and that cold breeze that enters his house, that itself is sufficient to bring in cold. Hepar, so sensitive they are. Hepar, calcareous, Baratas, Calice also are prone to colds. Soranum. Now what is the beauty of Soranum? Again from Alan's keynote. Yeah, they wear fur cap. And they wear fur coat. Hottest weather, you see Soranum wearing all these things. Okay, that is Soranum. Okay. So Hepar, Kali, Murk, Alumina. Want of vital heat. Alumina. Okay. Now the second very important thing what you also have in this particular remedy is that we saw this, that it's a remedy predominantly acting on the lungs. And I also told you it can give rise to serious pathologies. When I say it can give rise to, what I mean to say is it can also cure serious pathologies. Okay. So now one strong pathology that you have in Bacillinum is tuberculosis. Okay, I'll talk about this in detail. I'll collect more information from source books and I'll give you a picture that you will remember for a long time. So what I was trying to tell you here is, in tuberculosis, or you have this secretions, expectoration with pus. Bacillinum is used when there is excessive mucopurulent bronchial secretion threatening to occlude the lungs. There is so much of sputum, the chest is full of phlegm and there is a fear that it will occlude the lung. The only other remedy in this situation you need to remember is antimonium tartarica. The entire lungs, the entire chest is filled with sputum. So today we also realized it is not only antimonium tartaricum, there is a remedy by name Bacillinum which has a capacity to produce or which can accumulate so much of sputum in the chest. Death rattle is what we call in antimonium tartaricum. So from Dr. Borik's what I have taken, which I had already mentioned, is it has a capacity to change the color of sputum. From greenish, it can make the sputum colorless. Okay. So this is the remedy, and the remedy is Bacillinum. See, moving further, is there are few more situations mentioned. Now one more situation. Okay, so we'll go ahead. So one more situation what Professor Vithalkas mentions is past history. Right? Past history, or when there is a strong family history, or if a person has got frequent chest infections. In that situation, you can also think of Bacillinum as a remedy. So personal or family history of tuberculosis, or chest is the weakest area in Bacillinum. Chest is the main target in Bacillinum. Okay? And we were talking about the glands. So which glands get affected in Bacillinum? Sulfur, what is it? Cervical group of lymph nodes, yes. Mesenteric and inguinal. And what will Bacillinum do acting on these areas? It causes inflammation, swelling or induration. Absolutely right. Okay. So one more glandular affections with exhaustion is what Professor G.V. mentions. Glandular swelling with exhaustion. So when you have this combination, the glands swollen and the patient feels exhausted, you can think of Bacillinum. Okay. So what were the 3-4 situations we saw in Bacillinum? What was the first situation? Tendency to catch cold easily. Second thing is that sputum, capacity to produce sputum getting accumulated in the lung, and the sputum which can change its color, its odor after Bacillinum. Third thing what we saw is family history or past history of tuberculosis. And fourth thing, enlarged gland or glandular affections with exhaustion. Okay, fourth. Fifth what you have is when there is a history of ringworm infection. Okay, ringworm infestation. So you all know what this ringworm is. It's a fungal infection which is round and it resembles like a ring. Okay, tinea, many of the tinnias. Fine. So Bacillinum, when there is a history of ringworm infections. The last thing what I want to highlight here is, again sorry for the PPT, but what I want to highlight here is tinea versicolor. Okay, especially you see them happening on the back. It can also happen in the upper anterior part or sometimes on the face, any area. But predominantly this is the area that you see tinea versicolor getting affected. Okay. Now what is that you have in Bacillinum? When you read the introduction to Bacillinum in Clark, he says tinea versicolor associated with any other disease. The indication what he gives for Bacillinum is there a case of insanity is mentioned. Okay, in Dr. Clark's Materia Medica, a case of insanity which was treated with Bacillinum, and what was the indication? This lady with insanity had tinea. Fine. So that is the situation. Any condition accompanied by pityriasis versicolor may point towards this particular remedy. Okay. So it's a leading indication when pityriasis versicolor is present in combination with other affections. There he mentions a case of insanity with pityriasis yielded rapidly to the remedy in Dr. Clark's introduction. Okay, so must be this repetition, but anyway, it's important. So these 5-6 points you will have to remember. So before I close, or before we take up Bacillinum in detail in the next class, what is that foundation that I have given, and based on this foundation we will be building up the drug picture of Bacillinum in the next class. Okay. So to understand next class, today's class understanding is very, very important. So the remedy is Bacillinum burnet, and 3 areas you see this predominantly acting. Priority is given to the lungs, second is skin, and third will be the glands. And how do they look physically? They look very lean, thin, emaciated, malnourished. Okay. And then we also saw that in the medical history they can have a few situations. And the first situation we saw was a Bacillinum patient is prone to recurrent cold cough first. And second thing we also saw is the capacity to produce sputum. Okay. And third thing what we saw was what is it? Yeah, correct. Yeah, it also has the capacity to change the color of the sputum. Absolutely right. Then what else we saw? Huh? Yeah, when there is a family or personal history of tuberculosis, or a person is prone more to chest affections. Good. Then swelling of lungs associated with exhaustion. And then we also saw 2 more things related to skin. One was in the past history you will have ringworm infestation or pityriasis versicolor associated with other complaints. Okay, fine. So any quick questions or anything you would like to add? We are not yet completed. Fine. So next Thursday, hopefully, we'll try to finish Bacillinum. Any quick questions, inputs? Then all clear?